Hello and welcome to Public Health Uncoded with Dr. Saroj Pachauri, brought to you by Center for Human Progress in partnership with the POPMovement, where POP stands for Protect Our Planet. I'm your host, Drishya Pathak. We are back with another episode dedicated to raising awareness about the complexities of public health issues. As we have explored in previous episodes, the pressing concern of climate change cannot be ignored, especially its correlation with its impact on human health. After the great success of the International Conference and Pop Festival for Youth-led Climate Action 2024, presented by the POPMovement, where we engaged with 600 youth participants, it became evident that there is a significant gap in how young people perceive the impact of climate change. Climate change affects not only biodiversity, oceans, and the atmosphere, but most importantly, human health. In the near future, the youth will bear the brunt of these health impacts. In light of this, today's episode focuses on climate change and its impact on children's health. Our guest, Ms. Karina Weinstein, shares her personal story of experiencing climate change and her journey of working to address this pressing issue. Karina Weinstein is a refugee from the former Soviet Union who defied her immigrant community's expectations by pursuing a path in public service. Her work focuses on creating systemic change to facilitate access to opportunities for communities in the United States and around the world. She designed and developed social impact programs and strengthened the capacity of grassroots organizations serving immigrant communities. Welcome, Ms. Karina and Dr. Pachauri.
Karina, welcome to this podcast. A very warm welcome to you. I feel honored that you have agreed to lead this discussion on a subject that is very important, but which has not received much attention, actually. The subject of climate change and its impact on children's health. We have very little information on this, and it's a very important subject. I also want to take this opportunity to thank you for the chapter that you contributed to my book on health and climate change, which was also on the same subject. And what made this chapter so interesting and compelling was the fact that you really spoke from your personal experience. And when you speak from personal experience, the matter comes alive. It's quite different to what you're saying when it's all theoretical. So thank you very much for joining. And we are going to try and cover the ground as far as the subject is concerned in terms of what does climate change to impact children's health? Are there any equity considerations? Do some children are some children more vulnerable? Do we need to prioritize the impacts at the program and policy level? Do we have to do anything in terms of systems change to address more of these impacts? These are some of the questions that we are going to talk about. So I'll ask you the first question. How does climate change impact children's health?
Thank you so much, Dr. Pachauri, and thank you for having me on this podcast. It's a real honor. And thank you for providing the opportunity to contribute a chapter to your book. It's very interesting because in many ways, my personal entry point into the climate space was through my children. I'm a refugee from Ukraine, and I didn't really grow up with environmental activism or really thinking about climate change. And it was really through having two young children who've had childhood asthma and a whole host of respiratory problems. It's that I became a climate advocate, and that I became really knowledgeable and understood how climate change impacts children's health, and really the very tangible impact that these, seemingly kind of small issues like asthma and allergies that now are so common, the debilitating impact they have on children's lives in terms of just living a full life and participating fully in school and activities, as well as, of course, their caregivers and the systems around them, like the parents and schools. So, it's in a way, I guess I'm grateful to my children for, helping me to realize the connection between climate change and health, and becoming kind of helping me to become an advocate and help spread awareness. Because as you said, Dr. Pachauri, many people to this day still think that climate change is a crisis of melting glaciers and polar bears, which it's certainly, that is a critical component of, the result of global warming. But far less do people think about, the emergency room visits from childhood asthma and the longer allergy seasons and all of these very, tangible health impacts. People don't generally associate that with climate change. And so more and more, we need to spread the word. The research is slowly demonstrating those impacts, but I think there's a big gap in translating the research into kind of public health, into general awareness. And so that's really, where my work with FXB and the FXB climate advocates, that's what we try to do. And of course, through kind of using my personal experience, which is just one, and I'm one of many mothers or parents who are facing this, and recognizing, of course, the privilege that I have and the resources that I have to treat those issues. And like you said, Dr. Pachauri, the equity concerns are really, are real, and not all families or children or communities have access to the proper resources to deal with these health impacts. So, I think to just take a really important step back, we know that, the climate crisis is one of the most serious kind of challenges for humanity. The Intergovernmental Panel on Climate Change concluded that to avert catastrophic health impacts and prevent millions of climate change-related deaths, we have to work together to limit temperature rise to 1.5 degrees centigrade. We saw this summer really what it means for the world to live in this new reality. And, in Hawaii, Canada, and all around the world, these climate disasters, the people that impact the most are children and young people. So I think, the way I like to look at the climate crisis is this is a child rights crisis. We need to, climate change poses immediate harms to children's health, as well as, of course, long-term harm to inability to live healthy and productive lives, as all of us, want to. And children, even focusing on children is an equity issue because, children are the most impacted by climate change because their bodies are still developing. So things like air pollution impact children more than adults. But also, children contributed least to this climate crisis. And we know that children and young people today are facing more climate disasters than their parents or grandparents ever did. So and let me just outline, I think it's important to think about some of the climate, what are those concrete health impacts of climate change on our children? So certainly increased greenhouse gases in the atmosphere are leading to higher temperatures, more intense storms, lengthy drought, and that all affects children's health. These creating stressors such as extreme heat, poor air quality, erratic seasons, flooding, and infectious disease. Some of those health impacts can include asthma attacks and allergies, worsening pregnancy outcomes, which has long-term consequences for children, creating food insecurity, mental health, which I'll talk about later, developmental delays, and even changes in long-term genetic makeup. So as you said, Dr. Pachauri, there's not, it's an area of recent focus, but it's interesting to highlight some of the projections and the data that's out there. In the Agency for Environmental Protection, the Environmental Protection Agency in the U.S. released a report where they projected what would happen on certain health outcomes if the temperature increase was at 2 degrees centigrade and 4 degrees centigrade, which, if we don't take enough climate action, we may be heading in that direction. So just to highlight a few, the childhood asthma incidence is projected to increase between 4 and 11%. Due to changes in air quality, and climate-driven heat is expected to impact school performance, leading 4% to 7% reduction in academic achievement. And flooding is projected to cause 1 to 2 million, between 1 and 2 million children to temporarily be displaced from their homes. So these are, we know this should serve as a really important reminder of the urgency for climate action. And so some of the immediate health impacts include disease prevalence. So warmer temperatures can allow insects that carry disease to live in places where they couldn't in the past. So diseases like Lyme disease have become more prevalent. Mosquitoes that carry dengue and malaria and Zika are expanding as temperatures rise and rainfall patterns change. And of course, contaminated food and water that results from floods can also spread disease. And floods are associated with outbreaks of diarrheal diseases, which is a really dangerous for infants and young children. Air quality is another really important matter when we think about children's health and climate change. Air pollution globally accounts for 20% of newborn deaths worldwide, and thousands of children under the age of 5 die prematurely each year from lower respiratory infections that caused by air pollution from burning fossil fuels. Also, carbon dioxide, which fuels climate change, causes more pollen production in plants that trigger seasonal allergies. So, in my personal life now, my child experiences extreme allergies pretty much the entire year, and not just during what we traditionally thought of allergy season, which is spring. And it is actually a major concern for children, with allergies and asthma, how it's all connected. And then, of course, with forest fires, we've seen very recently in Canada and Hawaii, and these are just the most recent examples, but hot, dry weather can fuel forest fires, creating harmful air pollutants and damaging agriculture. In New York City this summer, we felt the impact of the Canadian wildfires, and the air quality outside was so dangerous. And of course, I'm very cognizant that many people around the world live with very dangerous levels of air pollution every day. But for New York to have experienced that concretely was just a strong wake-up call of how interconnected we are, and how, really the urgency to act, and, that how important air quality is. And the research is out there in terms of life expectancy and a lot of health outcomes, the impact of poor air quality, and especially on children whose bodies are still developing. And the one that really resonates the most for me, and that people don't always think about, are children's mental health, right? Of course, our physical health is really important, but we can't really be physically healthy without mental health. And children can experience trauma from major storms and fires, even just watching some of the news coverage from families who've been displaced as a result of wildfires, or families who've been displaced as a result of flash floods or really intense flood events. It's really traumatic. And so the mental health impacts of those are really lasting on young children. Also, from my work with FXB climate advocates, working with the youth from around the world, we know that children and young people feel eco-anxiety. They feel a sense of uncertainty and fear about the future, both from kind of immediate lived experiences from extreme weather events, as well as, just thinking about the climate change and the perceived inaction of politicians and elected officials and adults around them. So I think mental health is a really important health impact to focus in on as well.
Thank you very much. You have really drawn a very broad canvas to show what are the various different health problems that children can suffer from as a consequence of climate change. And you have provided data and information that is very, very enlightening. Thank you very much for for providing us this information. Can I ask you, what are the priority child health impacts that can be addressed at the programmatic and policy levels? Because we need to address these problems. So can you say a few words about that, please?
Yeah. In thinking about prioritization, of course, my gut response is that, we need to do everything. We need to do mitigation, and we need to develop climate resilient systems. But I would say, if in the short term, I certainly think mental health should be a priority. And in not only children's mental health, but really the support that the adults and the institutions that support children's lives can provide, because we know that children depend on adults for their safety and well-being. So I think in the most immediate sense is really focusing on children's mental health and developing their resilience. And this could be done, through a myriad of strategies, from comprehensive, compulsory climate education, which, globally is certainly lacking, but there are some positive examples in some countries. And even within the US, New Jersey is a leader in at least mandatory climate education. Certainly in parents being able to support and monitor their children for any eco-anxiety and depression. And then health providers and school psychologists and counselors actually being trained to detect eco-anxiety and depression in their students. I know that, our health providers aren't necessarily trained in climate impacts, and there are movements within the medical community to do that. So I think that's really important. And even the the mental health professional community is also embracing the need to better understand the mental health impacts. So I think the mental health is kind of a short-term something that we can address. But of course, in the long term, we need to reduce the burning of fossil fuels. We need to mitigate climate change, because all these actions that will curtail the use of fossil fuels like coal, oil, and natural gas, they're going to substantially improve air quality, and they're going to provide immediate benefits to children's health. Of course, that requires systems change, so it's not as easy. But also, I think kind of what we were saying in the beginning about this topic not being very much in the spotlight, we need all sectors, businesses, government officials, communities, to recognize the connection between climate change and health and incorporate information on the health benefits of climate mitigation into their decision-making so that we're informed. So something like putting bike lanes or having more green spaces in urban areas, or any kind of intervention that improves someone's physical health will also have co-benefits and can also have co-benefits, mitigating climate change and improving health. So it's really, I think, communicating better on the connection between climate change and health, and in using that data that's very, it's in a way, it's black and white. I mean, there's really no kind of doubt that climate change is harming children's health in these very concrete ways. So using that data to inform kind of local and global policies. And of course, the biggest, most important action is that we certainly need to wean our economy off fossil fuels, so that, that's really the underlying solution.
Well, you mentioned mental health many times, and actually mental health is a huge epidemic now altogether. I mean, no matter what issue you're discussing, mental health comes up right in the forefront. And that's an area that is firstly not being addressed very well. And secondly, we don't really have much experience in how to go about it. It seems like almost a stigmatized area in many ways. People don't even accept the fact that there's a mental health problem, and they tend not to go for any help with that regard. But on the other hand, this is a growing problem, and I'm glad you mentioned it. I think we definitely need to do something about it. Can you tell me what are the systems, the public health system, the provision of services, what needs to be strengthened to minimize impact of mental and physical health in children?
Yeah, for mental health, I have this anecdote. One of the FXB climate advocates from Bangladesh, Omar Faruqi, he's very kind of active and open about his story. During the global pandemic, during the lockdown, he became very depressed, and he even tried to commit suicide. And really that realization, and he would, with the support of his family, he was able to gain the support he needed. But that experience led him to become a child rights, climate, and health activist, and to really encourage children to inform policy and decision-making, because I guess, he felt very lonely and isolated facing these really, the uncertainty of the global pandemic and the climate crisis. And, he always shares his story. And, when I think about his story, I think about all the systems that, need to be strengthened around like young people like that who are facing these really massive issues like the climate crisis. So I think certainly the healthcare system needs to be better trained to understand the impact of climate change on health and detect, in a timely fashion, from pediatricians to specialists to, of course, mental health providers. I think schools, we did a eco-anxiety survey among young people in the FXB Climate Advocates Program, and they talked about how there's no one at school they can turn to talk about their eco-anxiety and, the sense of uncertainty that they feel about the future. What's going to happen after 2030? What's going to happen when they're working adults? I think, so that's another one. Of course, parents, caregivers have an important role to play. But I think on a more macro level, health, physical and mental health, there's social determinants of health that are really threatened by climate change. So, of course, clean air, safe drinking water, sufficient food and shelter. So I think investing in climate resilience in those sectors as well, to resilient water and sanitation, to education, schools, improving educational outcomes, improving access to health and nutrition services, improving access to social protection and poverty reduction, all of that, those investments will reduce overall climate risks for children globally. So we kind of need small actions, at the very immediate sense, and also big systems change in critical sectors that provide the necessary supports for, the social determinants of health. Yeah.
Thank you. Thank you. We need a lot of work, basically, is what you're saying. A lot of work in a lot of areas, and a lot of systems need to be changed, and a lot of advocacy needs to be done. Now, talking of advocacy, and we're talking about children and young people, what role can they themselves play in shaping climate resilience and mitigating policies? Do you think that could make a difference? And should it be done, and how should it be done, if it should be done?
Yeah, definitely. I think, young people have demonstrated that they're certainly not passive kind of bystanders. Young people are taking action in their communities and globally, from suing governments and state governments and for denying them the right to a livable future. They're mobilizing, with what we saw with Greta Thunberg, and now, globally mobilizing other young people. And they're also thinking critically about their individual consumption and trying to change, their immediate communities. So young people have a really critical role. They have knowledge, ideas, and initiatives that can contribute to increasing the resilience of their families. Certainly through the FXB Climate Advocates Program, I've been very inspired by the creativity and the really innovative thinking and approaches of young people. I think children and young people aren't necessarily constrained by the same norms that adults are. And so, I think they're really, they're demonstrating, right, that they are taking action and they can be more powerful than adults, but also their voices need to be heard, and they need to be embedded into policies. We need child-sensitive policies around climate action and environmental protection. And I think, I think young people have a critical role to play. I think as adults, we need to support young people's kind of agency, but also make really develop meaningful systems and mechanisms for young people to shape policies. So we have examples, like very concrete or small examples of young people. Let's say Annika in Lexington, Massachusetts, she joined her town's sustainability council and helped establish a library of things where people could borrow things instead of purchasing them. Another young woman helped craft legislation to ban plastic bags in her town of maybe 100,000 people. Small action, but she was a young person who contributed to this pretty major policy change at the community level. And then, of course, we just through the FXB Climate Advocates Program, and of course through Protect Our Planet movement, we see young people really taking stage, right, at climate negotiations and saying, wait a minute, we need investment into making sure that we can attend schools even when there's a flood and the road, has too much mud for me to walk to school, or, wash, that I can access clean water so I don't get sick. So definitely young people need to be involved. And I think this will make for more effective climate resilience and mitigation. I think what's different is that for most adults, there's like maybe a point when they realize that climate change matters. So for me, it was when my children, had recurring and debilitating asthma. But for young people, for my 12-year-old son, his whole life, he's lived with the climate change and the climate impact. He doesn't know any different. My 6-year-old son doesn't know that there was a time before there were 104-degree days during the summer. So, for young people, this is their reality. But the positive thing is that young people and the FXB climate advocates have told us one of the best strategies, one of the most effective strategies that they use to combat eco-anxiety and is climate action. So they say, we see the problem, we can't just sit there and do nothing. So we'll do something. And that something may, vary depending on their interests and kind of where they are and the resources that they have at hand. But they're certainly, by doing something, they're actually building their own resilience, and they're demonstrating to themselves that they have, an active role to play. But they, so I think young people have a really critical role to play. And, certainly their health is at stake, and adults need to really partner with young people to embed their perspectives, lived experiences into policies and programs and responses, and not always maybe speak for young people.
Yeah, what you say resonates with me completely, because I work with the POP, Protect Our Planet movement, as you know, and that is really based on the very hypothesis that you're enunciating right now. And that is to inform young people, provide them with scientific information on the issues of climate change and health, and then to stimulate climate action by the young people themselves. And they are the ones really that are, as you just said, are going to be most affected, and therefore would be most motivated to take some action that would bring about greater change, more effective change than adults probably would. And yes, this is extremely important, and I think much more needs to be done in this area. Because this is the future, really, and this is the way we are going, and the way we should move forward more quickly, more urgently, more rapidly.
Yeah.
That we don't have so that the children do not suffer from the impacts of climate change, and the next generation plays an important role itself to bring about climate action and greater resilience.
Yeah, and I'm grateful for the work that Protect Our Planet movement does, and for your collaboration with FXB and FXB Climate Advocates Program. I think joining forces is a really powerful strategy to support young people. And it's interesting. I think young people have, and I could, for my own children, have a different perception of time. They don't, it's immediate, and they want to take action, and they can become informed in a much more rapid fashion, through social media and technology. And of course, they need support and, deciphering information, but they certainly don't have that kind of, I don't even know, lowness that, adults have, the way I would approach a topic. And I think in a way that's what we need. I mean, I think the evidence on climate change, is pretty black and white. The climate impact are being felt, pretty acutely around the world, from the most developed to, least developing countries, of course, most felt by vulnerable communities, but certainly, someone in New York, when they saw that gray, yellow, air, was like, wow, something is happening. So, I think there's no time to waste, and young people get it. And I think that's, and their lives, their actual present lives are at stake. I live on Staten Island, and I think about, which is an island in one of the boroughs in New York. And I think about, well, can my children live here when they're adults, or will they be at risk of, flooding, or is it going to be underwater, in their lifetime? Can they actually live in the community where they grew up? And I don't know. And in fact, I tell them, we'll have to look at some climate data and see where they can live, in 20, 30 years because of climate change and all of the hazards. So, this is definitely, and young people get it. I think in the U.S., and I know this is globally as well, one of the things that I think is a barrier is, of course, climate education. And in the U.S. specifically, most young people have environmental science in high school, and that becomes an exposure to potential climate change. Unfortunately, it's just one lens of, around climate change, the kind of the technical scientific part of it, which is very important. But if you're not a scientific person, you may think, well, I can't be an environmentalist or climate advocate because I don't understand science, or, I have to be like a geologist or something. And I think that's where our education system fails to teach young people both on the intersectionality of climate change and climate impact, interdisciplinary aspects of it. And of course, young people tell us this unanimously from around the world, that they're not learning in schools on how to take climate action, that they can actually do something about it. And that's where, POP and FXB and others, we try to fill in the gap. But I think having comprehensive and compulsory climate education, interdisciplinary climate education will be key, because that's where young people turn to FXB and say, wait, I could see there's a flooding or these things are happening, but I don't really understand why, or all the impacts, or, and they don't really have the resources for that in school. And that's, yeah.
Thank you. Well, you covered a lot of ground, Karina, and I'm really grateful to you for having provided all this information. I'm sure that our listeners are going to benefit from this discussion. And thank you very much for the important work that you're doing, and for all the help that you have provided in terms of providing us this information today. Thank you.
Thank you so much for this opportunity. I'm very grateful to you to have this opportunity today to share a little bit more about climate change and children's health, and I hope to continue collaborating in the future for our shared goal and vision. Thank you.
This conversation has shed light on crucial aspects of our current reality. At the POP movement, engaging with young people daily, we constantly encountered three fundamental questions. How are they experiencing climate change? Does climate change impact their health? And how can they contribute to climate action? I mean, the simplest questions by Dr. Pachauri and the detailed linked responses of Miss Karina, they seem to be perfect capsules for creating awareness. It is imperative that we prioritize advocating for the health implications of climate change with a particular focus on children. Ms. Karina has outlined concrete health impacts on children, including asthma attacks, allergies, mental health issues, and developmental delay. And the truth is that children are disproportionately affected due to their developing bodies and limited access to resources. While long-term solutions such as reducing fossil fuel consumption and mitigating climate change remain crucial, immediate action can be taken to address these issues. This will include comprehensive climate education, parental support, and training of healthcare providers and school counselors to identify and address these challenges promptly. It is time to empower children to speak up about their health in the face of climate change and to ensure their voices are heard and acted upon. While we give you a thought to chew on and take action, we also invite the youth to come and be part of the POP movement. Thank you, Dr. Pachauri and Ms. Karina, for this amazing conversation. Let us keep growing this community of public health uncoded, and we will meet again with another important topic in our next episode. Thank you and have a nice day.